Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing very well. Warmer.
Yes, glad to be a little warmer. Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, a submitted question, and our lone U.S. COVID statistic through today, February 21st. We invite you to submit any questions, comments, or suggested topics down below via email or any of our social media linked in the description. Starting with that abbreviated COVID statistic, average deaths per day in the last reported week were 93. The same week in 2024, we saw 249 COVID deaths per day. Dr. Murphy, your reactions to those numbers?
Yeah, well, this is basically no change over the last couple of weeks. We are in the middle, or we're in the big hump of the respiratory viral infection season. The good news is that it's much less than last year. Last year was 249 deaths per day. This is 93. That's still a lot, but it's much better. So this is because we have a herd immunity in the United States and the world of people who've been sick with COVID multiple times, once or many times, and all the vaccines that have been given. All that builds up the immunity of the population, and it's paying off. And so we're into this like endemic period now, just like we are with the flu. So, COVID and flu are going to compete, and RSV as well, probably now, every season. It looks like it's not going to go away. That's the problem.
Mm-hmm. And we had a big question this week, a great question that is on a lot of people's minds. And it is with the confirmation of the newest health secretary for the United States. Is there a possibility that vaccines could be banned outright here?
Well, Mr. Kennedy, who is now the confirmed head of the Department of Health and Human Services, which oversees the CDC, the FDA, the NIH, everything, is a known skeptic. Vaccine skeptic would be about the most polite way to put it. He claims he is not an anti-vax person. However, his past activities and statements really are not supported by that. Anyway, there are things that can be done, that they can do without really changing any laws and not being technically a total anti-vaxxer. First of all, vaccines that are on the market would be very hard to take off the market. And, if everybody stopped taking vaccines, this whole place would turn into, we'd be in an infection nightmare. There'd be, tens of thousands of children dying. And, this would, cause slightly a revolution. But what they can do is kind of slow things down. They can just not promote things and always painting an adverse comment or position of a certain vaccine, and delay the approval of new vaccines and replace people on these advisory committees with people who think like him. So, that we call these like informal changes. And so I think some people would become unwilling to continue with all these childhood vaccinations, despite how many lives they've saved. For instance, we'll actually jump this into the next story here, where Louisiana has claimed that they're no longer going to promote mass vaccinations. Now, so this is just another step in the anti-vaccination tool chest, and it's very unfortunate because to get a vaccination, I mean, you have to make an appointment with a doctor or a clinic, you have to go in there, get the vaccine, and, there are some local side effects and whatever, but, at the end of the day, you're very protected. But if you start, and so these mass vaccination programs have been very helpful, like they vaccinate people at schools or after churches or, in the community someplace. And, to make it easier for people to get these vaccinations. These vaccinations, we're talking about ones that have been around for decades. We'll see, this is just another policy that's going to result in fewer people being vaccinated and then more people getting diseases like measles, mumps, rubella, diphtheria, tetanus, and whooping cough, to say the least. So, I mean, that's, I think, what we'll see. I don't think there'll be any banning of vaccines. I think it's just going to be delays and allowing people not to take it if they don't want to take it. And but people are going to pay the price for that. We'll talk a little bit about that later in another story.
So in summary there, because of the legalities and, all these committees, it may be difficult to outright ban the vaccines, but there are still a lot of things they can do to make it more difficult to access those things.
Right. And and as soon as you get the vaccine uptake lower, the lower it goes, the more outbreaks you have. Measles is the one that always gets reported because it's so contagious. If you don't have immunity to measles and there's measles in your community, you're going to get measles. It's that contagious.
Right. We have more on measles in just a bit here, but while we're on the topic of these, not industries, groups, federal public health employees, there has been some unfortunate cuts from the current administration to these public health leaders and these institutions. Can you break down what some of those changes were and how this may affect the whole system?
Well, what they're trying to do is basically, gut the government and to reduce the number of government employees in the parts of the government that they can control. So, the military is out, Medicare, Medicaid, Social Security, those are not being touched, but kind of everything else, which is actually not a huge part of the budget, they're just gutting. And so the easiest place they can do that are in employees who recently started at the agencies or have changed their position to a new position. And they're then technically called provisional. And you can fire those people. You can let them go without reason. When you're a provisional. When you're a full-time employee, you are protected. You have some employee rights. So what they're doing is they're just sweeping through these agencies and just getting rid of all provisional employees. So it ends up, what's happening at the NIH, for example, it's a huge organization, with $47 billion budget. They dismissed just like that 1,200 employees. In the CDC, about the same. They've done the same, and and people are leaving those agencies like they're nervous anyway. So another 700 at the FDA. These are people that are very highly trained, doctors, lawyers, PhDs with experience and very technical medical device experience. They're not like you can just go hire a bunch of those kind of people like quickly. Say you needed them back for some emergency or something. So what's happening here is basically like a generation of highly technical, skilled, and experienced workers is being kind of just let go. This is very risky. There's two very valuable services. One is called the Laboratory Leadership Service. This is a very prestigious training fellowship program at the CDC. Was hit very hard. They're like gone. And then the Epidemic Intelligence Service, these are the people that go out and, when you have like contaminated milk products, or there's a waterborne illnesses someplace, or Mpox pops up in someplace. These are the people that go and investigate those Legionnaire's disease at a nursing home, or something like that. This is the group that's trained to go out and do that. I mean, getting rid of they were the first year class of them was dismissed last week or earlier this week, and they've been reinstated. I think somebody woke up and said, maybe this is not such a good idea. So these are the people studying avian flu and stuff. It's like, we're at the about to have like a little epidemic of that. Hopefully not a pandemic, but so this was not very well thought out, and they're back. They are back. They're not. But the way it's going is so rocky and stuff. I think it's turning people off to working in the government. These kind of people, highly trained, taking a government job actually is not a monetary advantage. I mean, typically the government pays less than what they would make in private industry. So it's turning people off to the challenges of good public health. I mean, these people do it because they want to do it. It's ingrained in them, and this is why they went into this particular field. But I don't know, it's just a very risky time right now. This type of gutting, I mean, it's like the same thing with the FAA and the aviation. They were firing people. I mean, they don't even have enough people working in the FAA right now, and then they were letting people go and telling them to retire early. I mean, like, it's not, it would not be safe to fly if they lose more people. These people are not easy to replace. They're so highly technically trained and everything. So it's nothing short of a disaster right now.
Absolutely. All of the programs that Dr. Murphy mentioned that were gutted are, for the best and brightest Americans that we have here to go into public service. So it really is a great loss to those communities.
Yeah,
But
these are not political jobs. These are not, it's we're talking about people from every political persuasion. It's not limited to one group or another. It has nothing to do with that. It's all about, how much they're trained.
absolutely. Highly skilled people and also very patriotic. But looking into that avian flu that we were talking about, there has been a fourth hospitalization in a human confirmed, as well as more instances of that new strain D1.1. Can you tell us about the hospitalizations as well as that strain? Can you remind us what's going on there?
Yeah, so the thing with avian flu, there's like some 58 cases that are documented. There's probably many more. But anyway, 58 have been documented. They are all in people who've been exposed to birds or cattle or work in the industries like dairy farms or cattle ranches or chicken farms or whatever. There are no cases of human-to-human transmission documented yet. It's difficult for a human to give it to somebody. But anyway, so there are several strains. There's the B13.3, which is the most common strain, and it's a pretty mild strain. Very few people got very sick with that, and they tend to get conjunctivitis as well as flu symptoms. And then this D11 is, it happens also to be the one that the person in Louisiana who died had it, and the teenager in British Columbia had the D11. And then there's these two other people, one in Wyoming and one in Ohio now, who are in the hospital. So that's 4 out of 58. So it's not even 10%. But we don't know about those other two hospitalized ones, what strain they have. All right, so that's being tested. So we'll see. But this thing will mutate, and in this case, D11 is worse probably than B13.3, the original one. But still, there's no transmission human to human. So we we have to just keep following that. Another D11 was a dairy worker in Nevada that but wasn't so severely sick. Not everybody is severely sick with that, but the more they look, the more they find.
Mhm. And we've been talking about this a lot today, but measles. We touched on last week that there was, quite a sizable outbreak going on in Texas that has grown this week. Can you give us the updates?
Yeah, so in northern Texas, on the border there with New Mexico, I think it's Gaines County. It's a very high rate of unvaccinated people who've opted out of the typically required vaccines. It's easy to opt out of getting a vaccine in Texas, and then particularly in this area. And they have a lot of kids who are homeschooled, and of course they don't have to have they're not required to have any kind of vaccine. But anyhow, so this outbreak, there's so many unvaccinated people, like I said before, measles is so highly contagious that, a couple cases of measles happen, and then anyone who's unvaccinated is going to be at risk in that community because, it can stay in the air for hours, and it is really highly contagious. Now, it's not, and if you get measles, a lot of people say, oh, you just get measles. And, I've heard some very silly comments like, oh, everyone should just go get measles and then you'll be immune. Well, guess what? 1 in 1,000 children anyway die from measles. 1 in 1,000. So we used to have 3 to 4 million cases of measles per year. There were thousands of childhood deaths, and a lot of these kids end up in the hospital. Then they get in the hospital and they're so contagious. So I mean, they put everyone at risk in the hospital who was not vaccinated. It's just it really is a crisis, and that's what's happening out there. And it's spilled over into New Mexico. I think is very close to where Gaines County is, and they have like 8 cases there in New Mexico as well. And they haven't even identified, the actual contact of like a person from there went to that county or what. I mean, they can't even. There's nothing obvious about it. That's why they send these EIS officers, that just got fired and they got rehired again. They send them out there to investigate to see how they can do this, how they can figure this out. So it is very unfortunate. So anyway, the MMR, measles, mumps, rubella vaccine, it's very safe. It's been out for decades. There's no link with that, with autism or any other chronic thing. Kids typically take the shot between 12 and 15 months old, and a second one between 4 and 6. And most kindergartens mandate that you have to have the measles vaccine before you can come to school. Yeah, so I mentioned before, it was 3 to 4 million, used to be 3 to 4 million cases per year. And now it's around 200. But here we have 58 in just one place. And the vaccine rates are going down. Measles is so contagious that you really have to have above 93% vaccine coverage to keep it under control, 93 to 95%. When you drop below that, you'll start seeing cases like this. It happened in California years ago when kind of an anti-vaccine movement was going around. They had 14 outbreaks in California, and then they had to reinstitute the mandatory vaccinations for schools. And I think they closed Disneyland or something. I mean, there was an outbreak there, and it really can get out of control fast.
Mhm. And to that point, I mean, there was an additional 10 cases from last week to this week, and they knew that the measles outbreak was occurring. So even with the public health efforts and trying to quell that outbreak, it still was spreading.
Oh, yeah. I mean, first of all, you put the people at risk, you vaccinate the ones that aren't vaccinated. And, if these people are against the vaccination, they're just going to remain at risk.
Mhm. Now, our final story today, showing some great public health work, is that Uganda has discharged the last of the Ebola patients they were treating and reported no additional deaths. Can you tell us how many patients there were and a little bit of how the situation was handled?
Yeah, no, it was handled very well. So in Uganda, the last of 8 Ebola patients recovered. And they got released from hospital isolation. And so it just shows that, even in an under-resourced area like that, excellent and fast public health responses from the Ugandan health workers and the WHO worked really very well. And this is great. There was one fatality. It was a male nurse that we previously reported on. And, but everybody else has recovered. They documented at least 265 people who had been in contact with an Ebola patient. And at least 90 of them completed a period of quarantine where they were monitored closely to see if they get sick. And, then they're released after the quarantine is over. And so, it used to be Ebola was, killed up to 90% of people. But, if there is supportive care, like when they had the Ebola outbreak in West Africa, the mortality rate was much less, because if you have to support those people in the sickest period of time. So, yeah, so this was only 8 cases, and it looks like it's over for now.
Yeah, really great public health work there. And on that note, thank you so much, Dr. Murphy, for your time and your expertise breaking down all of these issues for us, as well as answering our viewer submitted questions. Very much appreciated.
Great. Well, have a good weekend.
Thank you, and thank you all for joining us for this week's episode of the Ask Dr. Murphy series. If you have any questions, comments, suggested topics, please feel free to comment them down below or contact us at any of our social media linked in the description. Hope to see you next week. Have a nice weekend.